overwhelmed. We've been lucky enough to win it on a few occasions, and it's just tremendous to see that we're, as a company, been recognised to be at the forefront of what we do. So super.
I'm totally thrilled. It's fantastic news for us, and just really thrilled about it.
Pharmacy is the route for selling the products to the patients, and that's why they play an important role in our business.
Dream come true. I think this is the most important award to me, the public health pharmacy, because I've always wanted to have an impact in public health. So this is a dream come true.
It feels strange because I wasn't expecting it, to be honest. I just literally applied because my tutor said, "Okay, I nominated you." So I said, "Yeah, why not? I'll take the challenge. It's a good thing to do."
I guess what I've done so far, innovation, trying to think forward, and making the most of what's available to you, I guess.
It's brilliant. It's recognition of what I've been doing for several years now. It's where I've been able to go out of the community, into the community, and actually do services, whether it's been to schools and run events at football grounds. Last week we were at Ipswich Town looking after people, and that was featured on BBC Breakfast Time last week.
It does feel really nice, actually. One of the problems with pharmacy is that when you work in a small village, a rural one, dispensary bench should be quite lonely, and sometimes you come out with some new ideas, and it's nice that other people acknowledge it and find it good and useful.
Amazing. I've had an amazing few years, really. I celebrated 50 years last year with a huge party in the village, and now this is just special.
Well, Voltron won it last year, and we've had another fantastic year, so it's absolutely fantastic to win the award. It's the number 2 brand, growing extremely well. We've got new products, and it's testament to pharmacy that we support pharmacy and pharmacy support us, and it creates successful brands, so we're really pleased.
I'm very honoured, very flattered that they should feel that, that I can be recognised for what I believe in, basically, which is community pharmacy and independent community pharmacy. I've been an advocate of our profession now for over 40 years, longer than I care to remember. But it's been a great ride, great profession. I'm very proud of everything that we do, and I do all that I can to ensure that we remain very significant contributors to the National Health Service in the future.
Amazing, just amazing, brilliant. Didn't expect to win, but it's actually, it's a big surprise. But I think it's all the effort and all the services and all the staff that's actually put all the effort into this, that's actually got us there.
Hi, Benjamin's Chemist in London N16 Stoke Newington, and this is the team who've won the team, because we are a team, and without them we couldn't get the prize. So with all of these guys selling and promoting healthcare, that's what it's all about. I can't do it by myself, neither can Bentley, although we try and fail miserably. But if it wasn't for condom distribution with Trish, health promotion with Kilton, and managing all the MDSs and kicking us to make sure all our paperwork's done from Sal. We've got 16 pharmacy services going on at the moment, and if it wasn't for all of these, we sure as hell as professionals couldn't do it. So it's a team effort.
Really great.
Fantastic. It's a very great achievement to come over here and win this award.
No, we're really pleased.
We're very pleased.
Really honoured, really honoured. It's fantastic. It's all about actually working together. So therefore, the pharmacy helped identify with the surgery a group of vulnerable patients, and by working with them and not competing with the surgery but actually cooperating with the surgery, we worked together to really enhance the patient experience, especially when it came within the medicines optimisation programme.
Yeah, there's considerable growth in it. There's much more emphasis now towards patients taking more responsibility for their own health, and natural health care dovetails very nicely with that.
I think we've got a really important role to play. We have great relationships in our local communities. I think we have a lot to offer. I think we're trusted by our patients. In my own case, I can relate to the fact that in the town that I worked in, Devon, I knew children, parents, grandparents, because I worked there for a long time, and they felt they were able to come to me with all kinds of problems. And for me, the key was always that they left my pharmacy happier or more relaxed or reassured than when they came to me. It wasn't a question of making a sale or maybe even supply a medicine. It was just talking to them, understand what their problems were, and sending them away maybe feeling a little more reassured.
Yeah, we want to carry on doing what we're doing, but we want all our pharmacy colleagues and our friends to also be appreciated, because I think they really work hard as well. It's nice to win this award, but I also want to say that there are really also lots of pharmacists out there who work as hard as us. And we want to carry on being really good pharmacists, and we want our community pharmacy to be really the hub of healthcare, really, in community.
Community pharmacy is the first place we go to for when we're talking about Voltarol and training. And when you talk to a community pharmacist, he has a team behind him who need to understand products, and they recommend products to consumers. And we work with community pharmacy to make sure that they understand the product and they recommend it. So our success is down to what pharmacists have done for Voltarol.
Community pharmacy at the heart of our business. They get the product that we manufacture to the patients, which is vitally important to us.
Future of community pharmacy, it's all about services, I'd say. Services, because with the NHS cuts and GP surgeries that keep being shut, people return to the next available healthcare professional, which is the pharmacy. They don't need an appointment, they don't need anything, they just walk in. So we need to be trained well enough to be able to answer to that demand of services, minor ailments, smoking cessation, everything basically that GP would do and nurses would do on a surgery. We should be able to provide it as well.
I think it's teamwork, it's dedication, and it's actually getting the community on your side. That makes a big difference.
Yeah, you've got to make the most of it, haven't you? And I always believe it's up to you to create your own path forward. So I'm very optimistic and positive for it.
Well, I think if you spend long enough in pharmacy, you realise the thorns that's in your side. And then you think to yourself, I've had enough of this. There's got to be a way that this could be run better. Technology is continuously evolving. And out of desperation, that the app was developed. And it works really well.
Well, I think you've got to be tolerant and be prepared to listen and with the customers. They're the most important. And if you can look after and keep your customers happy, then it makes a good, busy pharmacy, hopefully.
Well, public health is a subject that is very dear to my heart. I've actually got a master's in public health, and that is because I believe that the pharmacy is in a very good place to reduce health inequality in our community, because we're open, most of the time. People come in, they have the time to chat with us, and we could prevent health, not just treating health. We've got the opportunity to prevent.
The way the national health contract is now, that pharmacies can't survive without doing services. My plan is really to make sure we supplement as much as we can, as much that we can fit in with doing services to people.
Yeah, I think if we enhance the roles that are there for us, in other words, step out and show the NHS what we can really do for them, I think that's where we can really shine. We're experts in helping people manage their medicines, and the NHS needs to realise that and grasp it. There's a capacity issue, and we're there to help.
I think there is a future, but it's actually what you actually put into it. It's actually working with your local community, working with your local GPs, and making sure you develop your team to actually get to where you are.